Namaskar दोस्तों, welcome to channel Toxicology on Board. Today in this video, we will be discussing question number 36 from the series of 50 question quiz from the ABT. So in this particular video, we'll discuss about DABT question, ICH-S5 guideline, some of the important points, teratogenicity study, organogenesis period, etc. So let's directly dive into the question. So please read ICH-S5 R3 guideline. The guideline is detection of reproductive and developmental toxicity for human pharmaceuticals. Okay, let's see what is the question. To determine definitively that a chemical has potential to act as a teratogen in rats when during gestation, would you expose the dam? Okay, to demonstrate definitely that a chemical has the potential to act as a teratogen in rats when during gestation, would you expose the dams? As you can see in my previous video, also last video, I told you, very important, there are certain periods, first trimester, second trimester, or third trimester, the exposure period during the pregnancy, which will lead to certain type of specific toxicity. So they're asking that question. Let's see what are the options. uh, let's see what are the options. Option A is during organogenesis. Option B is pre and post fertilization of the female. Option C is during the implantation period. Option D is throughout the entire period. The right answer, as it is in green, option A, answer A, that is during organogenesis. Let's see what is the explanation and reference which is given by the ABT. Teratogens are most effective when administered during organogenesis, day 7 to 17 in the case of rats. So for this, they have given the reference. Please read Cassette and all 8 chapter, page number 36, and ICH S5R3 guideline 220, Enixure 1, in vivo study design section 1123, table 3. As you have seen, you can go back and check in my past video also. This particular table 3 is very important. In that video, we have detailedly discussed, as he said, repetitively same type of question, same area from where they are asking the question, you can see. So please read table 3 from ICH-S5 guideline. Okay, there is a comparison of all these three species, rat, rabbit, and non-human primates, and where are the important stages, exposure period, and what are the parameters, antemortem or postmortem endpoint that one has to see. So our answer lies here, um, that is administration period. GD 6 to 17 or 7 to 17 in the case of rats, 6 to 15 or 7 to 15 in the case of mice, GD 6 to 19 or 7 to 19 in the case of rabbit, and in the case of non-human primate, approximately GD 20 to at least GD 50. Okay, other things also you try to remember. Table 3 repetitively from the ISHS5 guideline is a prime area from where the examiner is asking the question. Now let's see what are other new things that we can learn from the concept related to this particular question. ICH guidelines S5A, choice of the studies, rat and rabbit embryo fetal toxicity studies. As you can see, in the case of rabbit 7 to 18, and in the case of rat 6 to 17. Try to avoid using the term killed. Instead of, please use the term sacrificed whenever you are using. Day 29 in the case of rabbits, animals were sacrificed. Day 21 in the case of rats. This teratogenicity study, segment 2 studies, also called as teratology or organogenesis studies or segment 2 studies. Segment here, typo error. Assess effect of compounds on development of offspring from implantation through closure of the hard palate. For that reason, I said in the table 3, you try to remember this particular thing also, closure of the hard palate. Okay, the period of organogenesis. Litter is experimental unit. Okay, the group of babies which are formed. Fetal examination, soft tissues and skeletal anomalies will be observed. Soft tissue defects evaluating using Wilson section or staple dissection techniques. Skeletal defects evaluating using Alzarin red staining bone, and for Alcian blue for cartilage. Okay, this is more important with respect to histopathology of checking those particular, evaluating the fetal examination. So you can see here external malformations may cleft palate is there, and in case of acephaly is there. Okay, absence of head. Then next, Next important thing that you have to read is the potential of chemicals to disrupt normal embryonic and or fetal developmental, which is nothing but teratogenicity. Teratogenic effects is also determined in laboratory animals. So what are those laboratory animals? Current guidelines for these segment 2 studies call for use of two species. One is rat, another is preferably rabbit. One is rodent, one is non-rodent, they say. Okay, you including one non-rodent species, that is usually rabbit. Okay, teratogens are most effective when administered during first trimester. As I said, no, specific exposure period will be there: first trimester, second trimester, third, for teratogenicity, first trimester, the period of organogenesis. Thus the animals, usually 12 rabbits and 24 rats or mice per group, are usually exposed to one of the three doses during organogenesis: day 7 to 17 in the case of rats and day 77 to 19 in the case of rabbits, and the fetuses are removed by caesarean section a day before the estimated time of delivery. Gestation day 29 for the case of rabbits, 20 in the case of rat, and 18 in the case of mice. This also information you can read it from the table 3. Okay, various stages, various stages. So gestation day ka bhi diya hai, cesarean, when to perform cesarean section also there. You have to remember that one. Okay. The uterus is excised and weighed and then examined for number of live, dead, and resorbed fetuses. Okay, live fetuses are weighed. Half of each litter is examined for skeletal abnormalities, and remaining half is for soft tissue anomalies. Okay, and micrognathia where lower jaw, short lower jaw will be there. This is the picture. Then next, as it was mentioned, no, you have to see important two criteria. One was Wilson's criteria was there, and another is Shepard's criteria. Okay, this you have to check in Cassett and Dowell ninth chapter, page ninth edition, chapter number 10, developmental toxicology, page number 549. Every time, as I said, no, whenever you're reading the textbook, you importantly concentrate on the figures as well as tables में lot of information will be there. So if you remember the table, many answers, many options you will be able to understand. So let's very quickly go through what is Shepard's criteria for proof of human teratogenicity. Proven exposure to agent at critical time in prenatal development. Number one. Second is consistent findings by greater or equal to high quality epidemiological studies, prospective studies, if possible, relative risk greater or equal to 6. Careful delineation of the clinical cases, a specific defect or syndrome is helpful. Rare exposure associated with a rare defect, probably 3 or more cases. Teratogenicity in experimental animals studies, important but not essential. The association should make biological sense, right? Some adverse effects is there. If it doesn't make any biological sense, then such can be ignored. Proof in an experimental system that the agent act in an unaltered state. So items 1, 2 and 3, epidemiological approach. Item 1, 3 and 4. 1, 3 and 4, rare exposure or rare defect exposure are essential items, and items 5 and 7, if you see 5 and 7, are helpful but not essential. So this is the Shepard's criteria. And coming to just very fastly go through what are these pictures are depicting. These are visceral anomalies or visceral effects are there, in which microophthalmia is there, where very small eye is formed, retinal folds you can see, and dilated ventricles you can see. These are all visceral malformations. Then we can see um, fetal evaluation. This is the normal skeleton, and you can see a absent tympanic annulus here. And fetal evaluations means something related to ear defect. It is fetal evaluations where you can see convoluted uterus is there, foldings you can see, and stenocytosis and rib anomalies is there. This is a normal one, and this is skeletal anomalies. Fused thoracic centrum, cartilage, and herniated diaphragm you can see. So let's also go through in this cassette and ninth Dowell's ninth chapter, so ninth edition, chapter number 10, developmental toxicology, page number 548 and 553, in which they have given about human developmental toxicants. Okay, they have listed out some of the commonly noted developmental toxicants. Why I'm saying is that in your options, if these comes, this will be very useful for you to in case of exam. Okay, first we'll see what comes under radiation, atomic fallout, radioiodine, and therapeutic radiation. Radioiodine, already one video on uh, radiation toxicology I have discussed. One of my early videos is on radiation toxicology only. So iodine, you try to remember, which used as an antidote, which is very useful for preventing thyroid cancer from, I think, uranium exposure. Such type of isotope it is there. And also, when it comes to radiation toxicology, another important topic, Chernobyl incident also you try to read. Okay. The next important, coming to infections, there is a lot many people might know. People think that thalidomide was the first incident, first disaster which led people to understand about teratogenicity. But before thalidomide also, there were some viral infections were there. Particularly, that was, I think, cytomegalovirus CMV infections only, where uh, uh, pregnant women who were infected with this particular cytomegalovirus virus, no, their children had some CNS anomalies were there. So before thalidomide also, CMV was important. This infection caused CNS related developmental toxicity was there. Try to read other type of infections also which are responsible for causing developmental toxicity. The next important thing is maternal trauma and metabolic imbalances. Many examples are there. For example, alcoholism. So, while pregnant women or pregnant, if they take alcohol or if they smoke, so tobacco is there. So, there will be certain anomalies will be there. Fetal alcohol syndrome, one of the important prime area where examiner will ask you one question. Amniocytis, maybe amniotic fluid if it is less, or the sampling is there, coronary villus sampling, no, you should not take before day 60. If that the volume additional or some kind of damage while at the time of sampling is there. So that is why that is saying maternal trauma and metabolic imbalance it is saying. Cretinism is there. Then we have diabetes is there, folic acid deficiency, hyperthermia, increase in temperature. All these things are also, they will be causing developmental toxicity. Please go back and read about the Sjögren's syndrome also, how it is related. This is some related to autoimmune diseases, I think. Then next we'll go and check drug and chemicals. Some of the common drugs and chemicals which are developmental toxicants. Okay, try to read not only this particular chemical with respect to developmental toxicity, any concept related to that chemical, any other adverse effects are also there. Try to remember, integrate that one. For example, here it is saying about first one is aminoglycoside, antibiotics, then androgenic hormones, angiotensin converting enzyme inhibitors, captopril and enalapril. So probably it might be a class effect, AC inhibitors ka. Angiotensin receptor antagonist, maybe sartans, they have this particular developmental effect. Anticonvulsants are there. For example, valproic acid will be there, phenytoin, which causes, I think, cleft palate is there, that you have to remember. Then anti-cancer drugs, busulfan is there, carbon monoxide. So carbon monoxide here as a developmental toxicity, you remember. Also you remember carbon dioxide, how it is causing, whether it is a part of this smog, which we have already discussed, no, London smog or photochemical smog. And also you try to remember how it is causing, if it is high, what is it, hemoglobin levels decrease, how the oxygen carrying capacity it is. So whenever that such topic comes, try to read everything related to that particular chemical or example, so that integration of the data, that will help you to resolve the question. Then we additionally we have other anti-cancer drugs, chlorambucil, cocaine is there, recreational drugs. Okay, coumarins is there, anti-gout drug. Okay, cyclophosphamide, cytarabine, diethylstilbestrol. So diethylstilbestrol, whenever it comes, try to read what is the mechanism of action, what are the other adverse effects. One historical incident is there with diethylstilbestrol, where the pregnant woman who has taken this, their daughters have developed vaginal or uterus cancer, some cervical cancer, something is there. Try to read that also. Then danazol is there, ergotamine. Ergotamine, try to read it with fungal toxins, corn and other cereals, how it is affecting, how it is causing ergotamine. Try to read that one. Then ethanol fetal alcohol syndrome and ethanol metabolism, you read what are the enzymes which are responsible for causing ethanol toxicity. Not only ethanol, you read other alcohols also, methanol, ethanol, ethylene glycol, all these three glycols. One video I have already uploaded where I have explained about the mechanism, what are the different enzymes, and how in two different species the metabolism of this particular alcohols is, and what is a toxic metabolite which is formed, which is responsible for causing toxicity, and what are the antidotes. Okay, ethylene oxide, fluconazole, folic antagonist, amantadine, and methotrexate, iodides. Lead and lithium is there. Mercury is there. Mercury organic, inorganic. How organic? Organic means methyl mercury. Methyl mercury is the one which is causing developmental toxicity. Inorganic mercury is the one which is having kidney as a target organ. And when it comes to methyl mercury or organic mercury, also read about bioamplification, biomagnification, how the concentration of that particular toxicant keeps increasing in the food chain. With that, minimata disease and chizo plant, that particular incident also in Japan, that also you read. Okay, next, methimazole, methylene blue. What, there are maybe some dyes are there, some coloring agents are there which are responsible for causing toxicity. That also you make a list whenever you are reading. Then misoprostol is there, penicillamine, PCBs, retinoid, vitamins, particularly vitamin A you will come across. Okay, in your options also they will ask isotretinoin, etranetate, or eccritinidin, tetracyclines. Tetracyclines, other effects, how they are affecting the children, that also adverse effects on children, that you remember. Then we have thalidomide. Thalidomide by itself, disaster, one particular historical incident. Read in detail as much about information, because in the recent non-mutagenic impurity guideline also, they have given thalidomide as an example. They have given how the based on the enantiomer, okay, isomers, one enantiomer, R isomer, how it is affecting S isomer, how it is can be used as a, that information is there, comparison. So best example thalidomide, enantiomerism, and repurposing of this drug. Nowadays it is used for leprosy treatment, that also you remember. Tobacco smoke, as I said. Then toluene and vitamin A, high dose. So vitamin A high dose, whenever you're reading about vitamins, also read about hormosis type of dose response curve. Why I'm whenever I'm giving some example, I'm also trying to tell you the concepts where they can ask is, see, generally dose response curve will be a shape curve. There will be some extra exceptional. Whenever we say certain statement, there will be exceptional examples of cases will be there. So in case of dose response curve also, U-shaped, inverted U-shape, for particularly for hormones and particularly for vitamins, because deficiency of the vitamin will cause you some kind of toxicity. Excess of vitamin also will cause some toxicity. That's why they will follow either U-shaped or inverted U-shaped dose response curve. So you read vitamin A, definitely they will ask you one question with respect to that one. So as we have in the previous slide, we have seen about Shepard's criteria. Now in similarly in table 10.3, we will see Wilson's general principles of teratology. What do we have? Can we remember all these things? I am not sure, but better you read, as I said, no, what are the list. At least you should know, okay, these are the principles are there. Okay, okay, if we not be able to remember all the points, at least name of those principles, at least if we will be knowing from the available options, we will be able to trace out the right answer. So let's very quickly go through Wilson's general principles of teratology. Susceptibility to teratogenesis depends on genotype of the concept and the manner in which this interacts with the adverse environmental factor. Susceptibility to teratogenesis varies with the developmental stage at the time of exposure to an adverse influence. Teratogenic effects act in a specific ways, mechanisms on developing cells and tissues to initiate sequence of abnormal developmental events, pathogenesis. The access of adverse influences to developing tissues depends on nature of the influence or the agent. The four manifestations of deviant development are death, malformation, growth retardation, and function deficit. So these are the four manifestations. Manifestation of a deviant development increase in frequency and degree of dosage increases from the no effect to the total lethal effect. So this is explaining about the dose response curve. Okay, I know it is difficult to remember all the points, all the 6 points immediately. At least fifth and sixth you try to remember. Other things repetitively by going through this particular table, you can read it. Okay, make a take a screenshot, keep it in your phone. So whenever you have some free time, you can go through it. Okay. The next important thing in the case of Clayson only chapter 10, you have to read in page number 561, 570. Please read table 10.5 as well as table 10.8. 10.5, it is having physiological changes when a certain species, or in case of human only, if you say if you are pregnant, what are the biological or physiological changes that will happen in that particular pregnant individual. So body water, how it is increased, body fat, how much, how it is increased, what are the effect of pregnancy, what are the changes in the gastrointestinal respiratory, how the heart rate is increased, or how, what do you say, cardiovascular, then renal kidney changes, creatinine or those levels, how they're increased or decreased, blood parameters, uh, all these things are metabolism, how the metabolism affected with the pregnancy, they have discussed. They are very clearly given whether a certain parameter has been increased or decreased, and by what percentage change is there. So try to remember, this will help you to interpret the data, whether the particular effect is adverse or not adverse, that you can see what is normal, what is adverse. If you know what is normal, then you can be able to interpret the data. For that reason, I have kept this table 10.5. And the next important thing is, also go through table 10.8, where they have given a comparison developmental toxicity findings in rodents and rabbits for known human developmental toxicants. So there are certain examples are there. These examples in the previous one also you might have come across. So positive, negative, or blank they have given. For example, certain chemical is there, whether it is positively it is causing developmental toxicity in rat, rabbit, or human. There will be certain example like methyl mercury, which is there in rat only, but absent in rabbit, but it is there in human. So as another example, I'll say one. Another example is thalidomide. Where it is. Here it is given thalidomide, where it was negative developmental toxicant in the case of rat, but positive in the case of rabbit, and positive in the case of human. So this gives an learning to us that when it comes to embryo fetal developmental studies, now if you see segment 1 study, it is done only in rodents. And if you see pre segment 3 study, segment 3 study is prenatal postnatal developmental study, which is done only in the case of rat. Only embryo fetal study is there, segment 2 study, where it is done in two species, one rodent as well as non-rodent. The reason is that if you look at rat pregnancy cycle, what are the various stages, whatever it may, it is not exactly equal to human beings. That is what I have understood, whatever I have learned from the literature, or my understanding is. So there will be certain window or certain exposure period which might be missed. If you do it in rat, and if you say negative or positive, that information is not enough. There is certain window period or exposure period which is not similarly to that of human. That's why they have recommended to use another species, that is rabbit. Okay, non-rodent species. So anything which is not captured in the one lower species in rodent, that effect might captured in the case of, might be observed in the case of higher species, that is rabbit. Okay, so similar thing happened with the thalidomide. Initially they have done in only rat, and they felt that there is no developmental or embryofetal toxicity, but when they have gone for other species in rabbit, they found positive. So a certain chemical will behave differently in different species. As you can see in the genotoxic test also, we don't do in a single test, we do a battery of tests. So if certain mutation, certain DNA sequence which is missed in one strain or certain assay might be captured in another assay, for that reason only. So similarly in the case of EFD studies, two species we are doing, one rat and one is rabbit. Okay, so let's see what else. Okay, thank you so much. Be curious. For any questions, please comment or mail to arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel, Toxicology on Board. Thank you so much. All the best for your exam.